one of the things I wanted to talk about are the alternatives to filler. And so, as plastic surgeons, and I think one of the strengths of us being plastic surgeons is we have an entire toolkit at our disposal. And so, whereas other specialties who may be trying to provide some of these services don't have the complete spectrum of what to offer patients, we do. And so, we don't always turn to fillers. Sometimes we think about things like Sculptra. And so, Sculptra is a great medication. It's been around for a very long time. It was really originally indicated for use for revolumizing the face for people who had a lot of atrophy in the face from different medical conditions. And so Sculptra can be something that you can use in the face, we can use it in the body. But we also love fat. And so being surgeons, we love harvesting fat through liposuction techniques and using it. And so what's important as people are becoming more and more successful in their weight loss journeys is being able to go to providers that can give them a multitude of solutions and also stay up to date on what is the safest, best thing to use, or be able to understand, hey, I've been having filler for 6 years, and how does that impact the rest of my care or what you can use in the future? Dr. Wasicek, what do you, I kind of, lot of words. Dr. Wasicek, what do you think?
I agree with you on pretty much everything.
Thank you. All right.
No, that's it. It's very interesting. Really, there's a multitude of things to think about. And, where is filler or other adjuncts like Sculptra, where do they fit in? And, when you think about this, you're really talking about the changes as we get older with facial aging. And it's a spectrum. And patients who, are 18 and they look super young, probably no role for it. But as we get older, we start having signs. And as you're in the mild to moderate category, I think that's probably the best use. And that's the best use of those adjuncts. And then when, those Sculptra and filler, when you have severe signs of aging and you're getting older, then really the more impactful surgery, the better results you're going to have.
Sure.
And so then you're really talking about surgery. In terms of Sculptra and when to use it and, what I think it's ideally used for, I think that when you're in that category of mild signs of facial aging, of little touch-ups, and it is different than, the HA fillers, and that it's a biostimulant, and that it induces collagen to be formed. It is a little bit, I guess, less predictable than the results of immediately with filler because it causes it to grow a little bit. So you have to be a little bit judicious and
educate patients
of what to expect. Yep. And, the people who are injecting it really should know what they're doing because, you might say, oh, you didn't do anything the next day. And then, a month later, oh, it's too much. And then we have to do something else. And it becomes a little bit harder to fix that as opposed to fillers. So, the importance of having people who have experience with it, can't be stressed enough. But it can be a useful adjunct because it's more permanent than fillers.
Much more has more longevity and more predictable longevity in some ways. One of the things we were really excited about when we brought you on was your expertise in facial surgery. We obviously do facelifts, rhinoplasties, those types of things, but I know that's something that is a real passion of yours, and you've done research and have some amazing cases already under your belt. What do you think when a patient comes to you and says, hey, I've had 6 years of filler, and then I went on Ozempic, and now I still have, especially in the mid phase, if you put our faces side by side, I'm the classic case of someone who actually needs some mid face volume, right? I'm super hollow here, which is probably because I'm older than you are. I'm hoping you're going to look as bad as I do later. But classic, I've lost that mid face volume. And so, what do you tell your patients when they're ready for a surgical alternative, but they've had this history of fillers, and they still have this lack of volume in the midface?
So I think there's a couple of really important considerations to make because the process of facial aging is not just descent of tissue, but it's also atrophy. So when you look at a picture of yourself when you were 18, your cheeks were a lot more full, and there's been a lot of fat atrophy within your face. And so,
I feel like I feel like you're diagnosing me right now, but go ahead. I'll try not to take it personally.
and so so it's not just of repositioning the tissues and addressing through a facelift of tightening and excising redundant skin, but it's also about replenishing the volume that's lost. And so an incredibly important adjunct for the appropriate patient, because again, people age differently, and the amount of changes from facial aging can be quite different, and it's a spectrum. But fat grafting can be a really powerful adjunct to replenish that volume and kind of make it not that you're back to when you're 18, but closer in that direction, much closer in that direction, to have a more holistic, change to reverse all of those different things with aging.
And I think that word you use, that holistic word, is really important. And I think sometimes it's a buzzword and people throw it around. Oh, it's more natural, or it's more holistic. But in some ways, as plastic surgeons, it makes a ton of sense because you want to address the problems in a way that is most effective. And part of that is actually fixing the thing that's changed. And so, as you, I think, so correctly pointed out, it's not just that things are sagging and you have less skin elasticity. It's like you've actually lost volume here. And if you're doing things that are just pulling things up or taking some of that skin away so your skin laxity is improved, you're still not addressing one of the root causes for facial aging, which is that atrophy. And so your younger generation, my generation, kind of had to learn it. We weren't really trained for it, but fat grafting, at least in my hands, and I think you agree, is really important in the right patients for facelifts, because it's a more, to use your word, holistic way to approach the problem. You're fixing things in a way that is directly related to the cause of why people look that way. And so I think it's super smart.
Yeah, I think that one of the things I like to tell patients is you have to consider everything and change things in harmony. If we make one part, much younger, but there are still other aspects that look older, not just a plastic surgeon will recognize it, but just any person walking across the street will say, that doesn't quite look right. Like part of their face looks younger, their skin is tighter, but they've had all of this fat loss and they still look older. Something's amiss. I bet that they had something done. So one of the things that's super important, that, the objectives of having good plastic surgery is addressing everything kind of in harmony to address all of those things. So you really can't tell, and people off the street looking at you will have a difficult time to tell whether or not something was done, or you just look great and you've never been out in the sun and you just you've been blessed by God with your genes.
And again, I think that, the wonderful thing about having you here with us is, and again, I think that for me, it was more of a growth thing. I had to kind of grow into, because that wasn't originally our training, but this concept that I think is very inherent to how you were trained as well is you want the most natural looking results. When I was training and learning how to do rhinoplasties, for example, like, well, get out the mold and just make that nose look like that mold, and then you've done your rhinoplasty. And whereas I had to undo a lot of that learning to say, well, wait a minute, let's think about the ethnic nose, or let's think about what the patients are really looking for and listen to those patients. I think that you have kind of that inherent skill set and those inherent thoughts kind of built into your training. And it's nice that we're both at the same place, but I think that naturalness and considering all the other elements that go to make what the patient's expectations are going to be are really important as part of that consultation and part of that discussion. Yeah. So super smart. Anyway, guys, I really enjoy these talks. And so hopefully you guys are enjoying them too, because I feel like it's just for me at this point. But let us know what you guys want to hear about or what we can talk about. We're super happy to have Dr. Wasicek as part of this. And I'll dress up next time.
I'll wear scrubs.
Okay, yeah, we'll switch. We'll switch. All right, thanks.